Hello dearies, welcome back to the channel. I hope you're all doing wonderfully well. So a lot of you have been asking if I can teach you some of the courses of nursing school, and I'm like, maybe by the time I finish that course, putting together courses that is done in nursing school, you would have become a senior staff nurse. I promise you, it's not easy. And then in my last video, I also spoke about using other platforms other than your nursing textbooks and your handouts in nursing school to excel through the courses of nursing school. And that brings us to today's sponsor, Lecturio. Lecturio is an online learning platform where they put together all the courses, most of the courses of nursing school that can help you, especially with the foundational courses, okay? The basics, the ones that you build your nursing care, patient care around, you find all of it on this platform. And I think it's a very good platform that if I was privy to when I was going to nursing school in 2010, 2011, I would have utilized because I've gone through some of the courses and it's it's just good. Okay, so without talking too much, because you know I like to talk, let's just have a look at the website. I'll share my screen with you, and I also point out some of the courses that I think, because I know a lot of you are now going to first year, so some of the courses you can start with, because some of you ask what courses you can start learning before you get to nursing school finally and start your training. Or if you are already in school, because I know some of you are already going to school, some of the courses that you can be learning alongside. So this one needs to go hand in hand with the courses you're already doing. Okay, so I'm rambling. Let's go to the screen. So this is their website. And it's not just for nurses, it's also for physician assistants and doctors. So if you're a medical student watching me, Lecturio Medical is for you. Okay, but today we are focusing on the nursing aspect. So I'm going to log in here, and so right away you see their videos, or the video library they have. And when you click on browse library, you see all the courses they have on the platform. So whilst we are talking about the videos, let's look at some of the courses that I would advise that you take, especially because you are going to first year. Okay, so for this one, I would recommend five courses for you to start with on the platform. The first one will be the nursing prerequisites. Okay, so the nursing prerequisites have the anatomy. You do anatomy in first year, so you do anatomy, chemistry, microbiology, and molecular and cell biology, and psychology and sociology. So you find that in our nursing school, the molecular and cell biology and chemistry are all fused under anatomy and physiology, but here it's like separated. Okay, so yeah, so the course number one is the nursing prerequisites, and then the next one will be the fundamentals of nursing theory. So with this one, you actually learn the history of nursing, how nursing started, some of the ethics, legalities, and all of that. Communication, which is very important in nursing. The nursing process. Yes, this one, it chopped my brain in nursing school. But here you learn how to assess, diagnose, plan interventions, and evaluate your interventions when you are taking care of a patient. So these are the fundamentals of nursing. And then the third course I also recommend will be physiology. So in nursing school, we do anatomy and physiology. The anatomy is the study of the structures of the body, and the physiology is the functions they perform. So you can do it alongside the nursing prerequisites courses. So you learn about all the body systems and the way they function to keep the body alive. Okay, so yeah, you have to take the physiology course, and then you do your clinical skills. So the clinical skills in our curriculum will be basic nursing. So this is where you learn all your basic nursing skills. So bed making, IV therapy, oral health, all the care that you actually give in the hospital. When there's a client on admission, this is where you learn all, and this is the I'll say the juice of nursing, because every other thing you learn in nursing school leads to this part, because this is where you actually give the nursing care to the patient to nurse the person back to health. Okay, so clinical skills, and this one can take this course and retake it again all through your nursing training, because at the end of your training, the practicals you do, the practical nursing exams you do, this is where it will come from. You can be asked to make a bed, a cardiac bed, simple unoccupied bed, and all of that. So this will help you through it. Okay, and then finally, I recommend study skills. Sometimes you feel like the chew poor pass and forget strategy we had in SHS can still be applied to nursing school, and you realize that so this course, I went through some of it and I realized that it's really, really good to help you actually know how to study and grasp information in nursing school, because whatever you are going to learn, you have to practice, you have to be able to use it on the field to help your patients. So the chew, pour, pass and forget is not going to help anymore. You have to learn with understanding, you have to learn the concepts and make it make sense to you before you can apply them. So learning how to study in nursing school is really, really beneficial. Okay, all right. So those are my first year recommended courses. The rest you can do whilst you are going on ahead, whilst you are moving ahead, because courses like medical surgical nursing you do in second year. Gerontology, we did gerontology in third year. So yeah, so as you move on, like maternity and maternity nursing and all, we did that in second year. So as you move along, you know what courses you can add on to not overwhelm yourself. And one amazing thing I like about this platform is that it's video. Okay, I'm a visual learner, and it's not just about video or people just standing there talking to you, but they do, like, they show pictures, and especially when it comes to the assessment and all those things, they give you vivid, like give you directions on how to assess them, and so it makes it easy to learn and understand. Now, there are other aspects of the platform that are really helpful and also helps to guide you when you are studying or keep track of your studying. First one is the study planner. So you can see here, I have nothing on my study planner, but when I go back to the video, so let's say I'm taking the clinical skills course, and there are a lot of videos under this one, so I can add it to my planner to set the time frame I want to study this course. Okay, so when you come here, you can add it to your planner and set the due date for which you want to complete the course. So for this one, I might say I want to finish this course by 31st March 2023. And then you'll be asked how many days per week you want to study the course. So let's say I want to do about 3 days a week. So here they've given you an estimated workload of 30 minutes per day, and I think that is cool. Okay, so now I've added it to my planner. So now when we go back to my study planner, I have this in my study planner. So anytime I want, I can just come, click on a video, and then watch it for the day, 30 minutes a day. And if I want, you can do more, or you can do just the 30 minutes, and then you'll be on track. And when you are overdue, they will also prompt you to take your classes. Another thing about the platform is their question banks. In nursing school, you realize that taking tests on the things you've learned helps you to, one, see if you really grasp the concepts you are learning, and two, help you to identify the gaps that you are supposed to fill when it comes to that concept or whatever material you are learning. And with Lecturio, they have their question bank already with each video. Let's go back to the videos. Let me show you this one. Already with each video that you watch, they have questions that you can take at the end of each video. So for example, this session on hand washing and hand sanitizer. So after watching the 5 minutes plus video, so after watching each video, you are given this question to see if you really grasp the concept that or what you just saw, if you learning has taken place. So they're asking which materials are required for correct hand washing. Select all that apply. So I can say mouth soap and warm water. And then how sure are you about your answer? So I'm feeling pretty good. And yeah, I got it correctly. And then you move to the next one. When using hand sanitizer, how long should you rub your hands together? I'll say about 20 seconds because I didn't really watch the video, so I'm not so sure. Okay, 30 seconds. Good. So you see, I failed this test, but this question will be served to me again in a different format to see if I'll get it right this time. Okay, so let's move on. That question will come again. What is the correct order of hand washing? Adjust water temperature, apply soap, wet hands. Remove jewelry, adjust water temperature, wet hands, apply soap, rub hands vigorously for 20 seconds. Raise hands, angle down, use a paper towel to dry hands everything. I think I'll take this one. And I'm pretty much confident. Yeah. Okay. So then the question comes back again to see if you get it this time. So when using the hand sanitizer, for how long should you rub your hands? 30 seconds. Now I'm feeling pretty confident. Yes. And then at the end of each video, you can make notes on what you studied. So these are the questions, like per video, you get questions per video to make sure that learning is taking place. But when you come to the question bank, let's say you finish taking a course or a series of courses and you want to test yourself on it. So you can come here to create a custom test. So they have test questions on all of the courses that they have on the platform. So with this one, you can select the difficulty levels that you want, whether either easy, normal, or hard, or a combination of all. So let's say I'm not so sure, so I want easy questions this morning. And then for the subjects, for you to be able to select the subjects that you want, you can check this box and click it one after the other. So this is for foundations, fundamentals of nursing. And these are some of the questions that are below. So you pick and then you start the test. You have 61 questions available, then you start the test. Okay, so this can help you in your general like assessing yourself to see if I really have understood what I learned. And it's no big deal. This is you and your computer talking to yourself. So even if you don't get some of it right, you know that okay, there's more work to be done, and you go ahead. All right. It's a premium platform. So you have a monthly plan and an annual plan. And if you use my code NESELASI20, you will get 20% off of any plan that you get. And I also leave a link in the description. Click on it. It will take you to the website to have access to the platform. Okay. So yeah, this is an amazing platform. And if you're also going back to nursing school after working for a while, like some of us will be doing next year, this is also a very good platform for you to revisit some of the concepts, because Post-basic programs are programs that you build up on. So we've taken some of these courses will also prepare you well for your post-basic programs, whatever the program is you are going to do. And I hope you give it a try. All right. My name is Selassie. I'm a registered nurse here in Ghana, and I'll see you in my next one. Bye.